Bismillahirrahmanirrahim. My name is Dr. Amber Rashid, and today my topic of presentation is SDG 3 Progress of Pakistan and Challenges Faced, under supervision of Professor Dr. Saira Afzal. In this presentation, I shall be explaining the sustainable development, the health related SDGs, SDG 3 targets and indicators, SDG 3 target Pakistan progress 2015 to 20 till the end of 2021 and the start of 2022. Recent advances and an MCQ session at the end. By the end of the presentation, the participants will be able to describe the sustainable development, the health-related SDGs, the target indicators, and how Pakistan has progressed till 2022. So sustainable development is the development that meets the need of person without compromising the ability of future generations to meet their own needs. What is sustainable development? It is actually the earliest most definition defines it as I've already told, the development that meets the needs. But recently, the three major components have been divided for sustainable development, that is economic growth, environmental stewardship, and social inclusion. It is about meeting the diverse needs of different communities to create better quality for life. The economic stability is defined as the stability to efficiently use the available resources, whereas the social stability is the ability to ensure the conditions of stability, democracy, and participation, as well as justice for human welfare. And environmental sustainability as the ability to maintain the quality and reproducibility of life. So this is a Venn diagram showing the three components for the sustainable development of environmental, social, and economic components. This is also a Venn diagram that shows that three dimensions of sustainability includes between social and environmental is bearable, between social and economic is equitable, and between all those three is sustainable, and between environment and economic is the term viable. So sustainable developmental goals were actually the transforming the world and under the agenda of 2023 for sustainable development under United Nations. And the goals are set by 17 aspiration goals with 169 targets, with focusing the same targets of economic development, environmental protection, and social equity. These are the transformation of how MDGs were changed to SDGs from 2016. Since 2000 to 2015, 8 goals and 21 target and with 60 indicators were the MDGs, whereas from 2016 till 2030, the SDGs will be implemented, having the 17 goals with 169 targets. These are all the 17 SDGs with starting from the the important are the health related is poverty, no hunger, good wealth and well-being. That is a focus of this presentation, and later on these are all the now health related development goals are goal number 1, that is no poverty, zero hunger. Goal number 2, goal number 3 is good health and well-being. Goal number 4 is quality education. 5 is gender equality, and 6 is clean water and sanitation. So good health and well-being, the SDG 3 goal addresses all major priorities, ensure healthy lifestyles, and promotes well-being. So targets includes 13 targets, and each target has 2 or more proposed indicators. Now SDG 3 has 13 targets, 28 indicators. These are now it mainly focuses on maternal mortality, communicable diseases, mental health, family planning, universal health coverage, and the 4 means to achieve the SDG targets is implement the WHO framework convention on tobacco control, affordable vaccines, support the health workforce in developing countries, and early warning system for global health risks. So what is the progress of Pakistan? So SDGs in Pakistan under Vision 2025 started recently. The third SDG relates to the human health and was first defined in 1948. The SDG 3 aims to good health and well-being and ensure healthy lives and promotes well-being, whereas health contributes to all the SDGs but benefits from progress made in others is also important, but these SDG 3 is mostly related to the good health and well-being. So the third SDG has 9 targets, 4 enabling actions, and 28 indicators. So, Universal Healthcare Index is one of the important part for which the whole SDG Sustainable Development Agenda was established. And WHO World Bank has developed an index to measure the universal health coverage. And the target to be achieved is 2030 is 80%. And the Universal Health Index in Pakistan has improved from 39 to 49. In 2020, this need to go up by 30 by 2030. The first target under SDG 3, that is 3.1, is related to maternal mortality. So the targets to reduce is by 70% by 10,000, 100,000 live births. Pakistan has come a long way from 306 in 2000 to 186 in 2020, but it's still very high. And according to Pakistan Demographic Survey, published in 2069% of deliveries are now conducted by skilled birth attendants and 66% deliveries takes place in health facilities. That is a good indication of improved health care in Pakistan. The second target is to end preventable deaths of newborns and children. So far, at least neonatal mortality at least as low as 12 per 1,000 live births and under 5 to 25. And under 5 mortality rate for Pakistan was 71 deaths per 1,000 live births in 2020, and neonatal mortality rate was 40.4 in the same year. Third target is the end of epidemic of AIDS. The target set is by the other countries that we have the highest rate of increase in HIV cases, and around 25 new cases have been pooled. And the fourth highest prevalence for the multidrugs TB, as well as highest prevalence for HIV. The fourth target is the premature mortality and the non-communicable diseases. For that, there has been a national action plan of 2021 to 30 on NCDs and mental health, that under which the many programs has been started to reduce these non-communicable diseases and to promote the latest treatments. Cardiovascular diseases with underlying high prevalence of risk factors like blood pressure, hyperlipidemias are common NCDs, and going by the trend, there is no likelihood that by 2030 we will be able to achieve this target. And the fifth target is to strengthen the prevention and treatment of substance abuse. For this, the UN has reported that Pakistan is one of the most drug-affected countries, and 7.6 million drug addicts are around in Pakistan. And people still don't provide proper replacement therapy to the addicts. So this is, and cannabis and heroin has been reported as the most abused substances in the country. The sixth target is to halve the number of global deaths and injuries by RTAs. So the last long past the deadline, Pakistan continues to see more deaths and injuries due to accidents. From 2000 to 2019, the injury burden has increased from 4.7 to 6.3, and in 2019, injuries constitute 5.7% deaths in Pakistan. The seventh target is the universal access to sexual and reproductive health care with family planning and other aspects. And one of the biggest development challenges that is faced by Pakistan today is unhindered population growth, and have become the fifth largest country, and 2.4% we have one of the world's largest population growth rate. The contraceptive prevalence rate is extremely low, that is 34.5%, and the contraceptive prevalence rate of 34 means that 65.5% of women of reproductive age and their partners are not using any contraceptive method. The ninth target to the sustainability is to reduce by 2023 the number of deaths and illness from hazardous chemicals, and focusing on water and soil and pollution and contamination. And it is estimated that a lot of people die from air pollution in Pakistan. 2030 population has access to safe drinking water, and the primary source of contamination is sewage water. A secondary source of pollution is toxic chemicals. The combined effect has already weakened the health system. The smog, the AQI, the worsening AQIs have really affected the overall climate of Pakistan. And while there are more than 7 years to achieve this goal, Pakistan's chances of achieving SDG 3 by 2030 are bleak. So this is the figure of performance in the selected SDGs, showing the minimum range in blue, with the median for low income here in yellows, and for Pakistan are here. We are here. So seeing the for SDG 3, we are still in 40-60 percentage of achieving that goal. This is an additional spending required in healthcare by 2030. And we have seen that the main issues we are facing in healthcare system is doctor per thousand population ratio. It has although increased, but still it is zero point 0.6, and it is expected to rise by zero point 0.9. Similarly, the wages, the current capital spending, the private shares, they all we can see that the private sharing has will be decreased if the common trends will continue. With the SGG 3 index is 50, and with GDP per capita spending in US dollars in 2018 was 41, and it expected to rise to 151 by 2030. This is an area map showing the different programs run by the UN and the UNDPF for improvement of healthcare all over Pakistan, showing that Multan and Faisalabad and other countries, there are several programs being run by the UN organizations to improve the SDG 3 in Pakistan. So the main hurdles that we are facing regarding SDG 3 is the high maternal mortality, the low skilled birth rate by the skilled birth attendants, and high under 5 and infant mortality rate, HIV incidence, TB, multi-drug resistance, neglected tropical diseases, hepatitis. Also, the drug abuse ratios are high, decreased universal health coverage index, and other indicators. This is the progress report for the Good Health and Wellbeing Pakistan from 2015 to 2020 in a tabulated form. Such an added information, and it's a detailed information of how the baselines from 2015 has changed in 2020, and the SDG target by 2030, how it has changed. Some of them have been mentioned, like the incidence of TB that was 270, it has decreased into 259, but WHO's top TB partnership, 20 cases per 100,000 by 2030 is the target to be achieved. So for malaria, it is 9 cases per 1,000. So it is all set by the, or we don't know that either we will continue or not. Good health, well-being, Pakistan progress. This is the third one with showing the total alcohol per capita, and the drug abuse has not been defined, and the road traffic accidents also shows the mortality that has been same till 2015 to 20, and we are globally achieving to get half of the number of deaths due to RTs. These are all the here we can see that the vaccination coverage, the targets have not been defined, but we can see that we are somehow declining for PCV and other, and also the net official development assistance to medical research has been increased. So it's all in tabulated form. So this was the world, our world in data that shows international health regulation scores capacity index for Pakistan in 2016 and the 2020. So the percentage of attributed of core capacities have been attained to a specific point, like the radiation emergencies, the national health emergency framework, the zoonotic events. These are all the things that are being done under SDG 3 to improve the overall index and the healthcare in Pakistan. So the SDG in overview, progress, status, and trends, that Pakistan has been going from bad to worse and has not been improving that much that was expected in 2015 or 2016, and an increase, and Pakistan is striving to increase the critical workforce but is unable to do that for several reasons. And also there are several key initiatives like National Health Vision Pakistan, the Occupation Safety Health Act, Khyber Pakhtunkhwa surveillance response. Although many initiatives have been taken, but still we are unable to achieve the specific targets due to some hurdles like high growth, high birth rate, high mortality, infant mortality, and maternal mortality, etc. So the challenges to bring healthcare service closer to Pakistan population is the availability of rural ambulance networks, meaning that increase the healthcare at basic health units in rural areas, improve the accessibility. Also, following the development of human resources for health, improvement in budgets, the total GDP per capita that has been allocated to healthcare must be increased. to combat all these with public-private partnership and legislation and communication at with district and national and international levels with the proper coordination. So priorities and targets is for in order to make substantive progress to SDG 3, Pakistan's priorities includes, uh, here I will summarize it, that sustainable increased spending on health, reducing maternal mortality rate to 130 deaths per 100,000 live births, reducing the infant mortality to 42 deaths, complying with international health regulations, establishing a network for maternal and neonatal child health to hospitals, strengthening the quality and increase availability of health workforce, addressing school health and mental health, and improving the health data generation and utilization. So for some of the recent updates, so this was the Sustainable Development Goals, a way forward for Pakistan, and it was recently published showing that among SDG Goal 3 targets, direct countries to ensure healthy lives and promote, as it has been discussed. However, the health is not solely a component of it, Goal 3. Throughout, so other aspects are also being covered, like drug abuse, alcohol, pollution, environmental, and other aspects. So, throughout the majority of SDGs, some targets have a direct or indirect effect of health gains and thus require special consideration with developing strategies, policies, and plans to achieve. So, how the UN is supporting the sustainable development is through UN SDF, and also the framework is the medium for strategic planning document with planned results focusing on 10 key outcomes and improving and achieving the SDGs by 2030. So one United Nations program 2018 to 2022 is for the United Nations Sustainable Development Framework for Pakistan that aspects 10 indicators of economic growth, decent work, health, wash, nutrition, and resilience, and going on. These are also the same 10 indicators previously described. So, our ultimate aim is to achieve development objectives that are equitably attained in line with Pakistan, rich potential so that fruit for development fully beneficial for all the people of Pakistan. That is a message from UN nation country teams. There has been also a Ministry of Planning and Development and Reforms that focuses on these SDGs. And Pakistan's commitment to these SDGs is that stakeholders for coordination and strengthening efforts federal and provincial level to achieve Pakistan's sustainable development and 7 pillars of Vision 2025 are fully assigned to SDGs, providing comprehensive long-term strategy of achieving inclusive growth and sustainable development. And we believe that SDG agenda for development isn't an international agenda; it's our own agenda. It reflects our ambition, desire to give our people a better quality. Therefore, we must take ownership of SDG with complete devotion and passion. So now it's time for the MCQs. The MCQ 1 is the Sustainable Development Goals are the collection of 17 interlinked goals for the developing and developed countries. What is the third goal of Sustainable Development Goals? Clean water, sanitation, end poverty, gender equality, good health and well-being, zero hunger.
C.
Yes,
Delta.
it's delta because the SDG 3 is mainly focusing the good health and well-being. So D is the right answer. SDGs were set up in 2015. Sorry, it was around about 16, and then were intended to achieve by 2030. The main agenda of SDG is transforming for sustainable development. The following is the example of sustainable development: construction of coal power plants, construction of oil refineries, development of well-designed green spaces, increased use of insecticide, pesticide, fertilizers in agriculture, landfills through e-waste.
C.
Yes, C is the right answer. Yes, C is the right answer. Development of well-designed green spaces is the part of under the environmental sustainability target. Chronic and catastrophic diseases continues to be one of the primary drivers driving households out of poverty and hardships. Non-communicable disease plays a significant impact on human health around the world. How many SDGs goals are related to health? Either there are 8 SDG goals, 5 SDG goals, 7 SDG goals, 6 SDG goals, 2 SDG goals that are directly related to health. Any idea?
Delta.
Delta.
Yes, delta is the right answer. There are total 6 goals that are actually related to health. Gender inequality is still a problem in sub-Saharan Africa, and it is one of the world's most unusual regions. The prevalence of cultural norms that exacerbate favoritism towards males. The focus of gender equality is essential captured in Sustainable Development Goal Dash for the 2030 agenda. Either is SDG 5, SDG 3, SDG 2, SDG 4, or SDG 1. This is
Delta.
yes, this is the SDG. Actually, it is the SDG 5 that focuses mainly on the gender equality to have the sustainable development. ABC developed country with 23% adult deaths annually of non-communicable disease. The health ministry adapts and joins the leagues of upper middle class countries by the SDG agenda. To resolve this problem, which health related SDGs an ABC country predominantly focused on? SDG goal 5, SDG goal 3, SDG goal 2, SDG goal 4, or SDG goal 1?
Beta.
Yes, it is SDG goal 3 that is related to the non-communicable, chiefly the cardiovascular diseases, the cancers, the chronic respiratory diseases, and diabetes mellitus. Tobacco epidemic is one of the most serious public health problem in XYZ developing countries. One of the 17 goals of sustainable development goals is to promote health and well-being. The WHO framework for Convention on Tobacco Control is SDG 3 targets. Dynamic targets means to achieving targets, outcome targets, output targets, or predictive targets.
Beta.
It is yes, it is B means to achieving SDG targets for under the WHO framework convention tobacco control. For the past 10 years, chronic and catastrophic diseases have a primary problem for the households from poverty and deprivation in XYZ community. The country should adopt and implement the SDG 30 vision, which is the goal of SDG aimed at eradicating poverty worldwide. SDG 5, 2, 2, 3, 4, or 1. It's an easy one.
Delta.
It's poverty, eradicating poverty worldwide. Yes,
SDG 1.
yes, SDG 1 is the right answer. Focuses on eradicating poverty. Pakistan is the first country to adopt SDG 30 agenda to coordinate and strengthen efforts at federal and provincial levels, achieve Pakistan's sustainable development goals. Dash are fully aligned with SDGs, providing the comprehensive long-term strategy for achieving inclusive growth and sustainable development is the part of National Program for Family Planning, Pakistan Demographic Health Survey, Pakistan Vision 2025, Prime Minister National Health Program, or Social Action Program.
C.
Yes, C is the right answer. This is the agenda for the Pakistan Vision 2025. Ninth MCQ is developing countries' population growth is much higher, while resource consumption is higher in the developed countries. The goal of sustainability is to provide basic standards of living of all people. Which of the following option is correct when we accomplish the 3 pillars of sustainable development? Economic development sustainability equals viable. Economic equitable and environmental sustainability plus social, economic plus environmental sustainability plus social equals equitable. Plus economic sustainability bearable, social plus environmental sustainability equitable, or social plus environmental bearable. That was from the
Beta.
Venn diagram I showed you.
Bravo.
Uh,
D.
Actually, it's
E.
E. Yes, E is the right answer. Social and environmental equals bearable, meaning that both these indicators can improve under this heading of bearable. And MCQ 10 is the sustainable developments are the sets 17 ambitious goals. And in February 2000, Pakistan National Assembly adopted SDGs as the country's development. Pakistan makes significant progress in the improvement of dash indicators of SDGs from 2000 to 2020. A significant progress in improvement of international health regulations, maternal and child health, prevention of substance abuse, prevention of TB, prevention of HIV and AIDS. Which has shown
Beta.
yes, beta is the right answer. It is maternal and child health that have showed a bit increase. So this is the key. And the thank you. And there is a YouTube link. So
Thank you very much, Dr. Amber. Very nice presentation, and especially your part that is about the recent advances and MCQs that are so good. It was really a treat for everyone. And whenever we talk about the 17 very ambitious goals of sustainable development goals, we are always looking forward for the urgent call of action from all the countries, either developed or developing. So these are the 17 SDGs, and their importance cannot be fulfilled fully if we are not able to achieve them. And in a lecture, yes, many important things have been discussed, but we always think that there are more call to action and there is a more research that is required, because that is the blueprint for peace and prosperity for the people, and especially for the developing countries like Pakistan. We are looking forward to many important things that are going to be done in future. I would like Dr. Sadia for her comments, please.
Thank you so much, ma'am. No doubt it's a really wonderful presentation with all
Dr.
the.
Sadia, would you like to have your comments here?
Ma'am, can I'm unmuted. Can you hear me all? Hello.
Yes, you are audible, Dr. Sadia.
Yes, we can hear you.
Yes, we can.
Okay, okay. Uh, what I was saying, ma'am, it's really a wonderful presentation, a very good and important topic according to exams point of view. And Dr. Amber has elaborated it very well. And the MCQ session was really very good with a lot of confusion and goals. Otherwise, very nice presentation. Everything was very good. Thank you so much.
Okay, thank you very much. Allah Hafiz,
Allah
everyone.
Hafiz.